most famous physical therapist on the internet.
Hi folks, I'm Bob Schupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So what is causing your shoulder pain? Is it impingement? We're doing kind of a series of things that we're trying to assess your shoulder pain, and we're going to talk purely about impingement.
Which is a relatively common
Very
diagnosis.
common one, actually. The best way to think of a shoulder impingement is some structure, usually a tendon, is getting pinched. You think that's accurate, Brad?
Yeah.
And
well, that's why it's called impingement.
Yeah, I know. Well, impingement, not impingement. If the pinching continues, the tendon is going to get sore.
Mm-hmm.
And if you continue the pinching, it can start to wear out and get frayed like a rope.
Right. That tendon is through there. We'll show you on our SAM a little bit.
Watch bring it over, Brad.
Sure.
And eventually that tendon can even tear. So basically, an impingement can lead to a rotator cuff tear. So, Brad, do you want to show? Got Gumby.
Oh, yeah. He's watching over us. So here's where the tendon is. We got it in pink. I think I would call that pink.
Yeah.
And it goes underneath the acromion here, this bone that's part of the shoulder blade. And it goes in here. And actually the muscle belly lays right in here above the spine of the scapula.
Yeah, so this is a supraspinatus muscle and tendon.
Now, look what happens right when here where I put that pen. Are you in on that, Mike? If I go up like this, it's pinching the pin, which is actually pinching the tendon if the pin's not there. But what happens with a healthy shoulder,
there's enough room there.
Yep, the ball actually drops down. They call it the caudal glide. It drops down, maintaining a healthy space in there. But when you have rotator cuff problems, that's not working properly, and then you get that impingement, and then this whole scenario arises.
And we'll go over all that in other videos, but a lot of times it's just poor posture.
Sure.
If that scapula or the shoulder blade is forward, it can cause that pinching here. So what are the signs if you have an impingement?
Are we done?
Yeah, we're done with that. Thanks, Fred. Generally, you don't have pain at rest. The pain is when you reach like forward to the side or to the back like this.
Scratching your back.
A lot of times, especially you get up to a certain level.
Yeah.
And that's where that pinching occurs. Sometimes you can even have pinching, and then it stops pinching depending where the irritation is located.
Painful arc syndrome, they call that.
Painful arc, yeah. So it actually, and a lot of times I tell this to people a lot, is pain can make the shoulder feel weak too.
Right. Yep.
Like you're thinking, it's really weak. I must have tore something. Sometimes it's just so painful that it feels weak.
Yep. The body tells those muscles to turn off, trying to protect itself.
Now, this is something over time, the pain and weakness could worsen because you keep irritating. You keep hitting something with a hammer. It's going to keep getting, worse.
Yeah, something's going to bend or break.
Yeah. So obviously, too, this is going to have difficulty lifting objects overhead when you have this type of problem. A lot of times you feel a really sharp pain at the top of the shoulder. People a lot of times think like something's got to be really wrong because this thing really hurts.
And even though the impingement is there, I have a lot of people say the pain is just down and it's a referral pain. It's really from there, but it feels like there. There was something else I was going to mention, Bob, but it'll come back.
Yeah. The other thing is sleeping on the shoulder often makes it worse.
Right, exactly.
So we'll start going in some of the tests here, Brad. So we got 3 tests that you can do. My only caution is sometimes some of these tests could also be positive for an acromioclavicular problem, which, in other words, right at the end of the collarbone, there's a joint right here, and some of these tests are going to hurt also with these tests. Just keep that in mind. Again, you're not trying to be doctors here. You're just trying to maybe give your doctor a little hand and give yourself some knowledge. I mean, it's always good to have extra knowledge.
When the doctor or therapist is doing the test, you'll say, oh, this makes sense, and you'll understand things better.
So let's say this is my painful shoulder arm.
Sure.
Okay, I'm going to take my hand and put it on my opposite shoulder, and I'm just going to lift my elbow up as high as it'll go. And I actually feel just a little bit on there, Brad.
Yeah.
Do you feel anything?
Even a healthy shoulder may have some impingement with these tests, but it should, like mine too. And on this, do you ever give a little overpressure on the elbow?
You give a little overpressure. Absolutely.
And the nice thing about the shoulders, you have two of them typically, so you can test the other one and see how they compare.
Yep, exactly. If you have one that's really been the problem child, you can see, if that one is a lot worse with that test. The second one is, now this is a little bit complicated. There's a way to do this without this little version of it, but I thought this is better if you can do it this way, because what we're trying to do, you sit sideways on a chair. I am trying to stabilize the shoulder blade a little bit. I'm trying to stop it from moving up. Your shoulder blade actually moves up and down. So all I'm doing is I'm leaning against that shoulder blade.
So his shoulder blade,
is right there.
Right. The tip of it is right down here, and you'll feel it, because when you do that, you'll feel it move against the chair.
Yeah, you're up against the bone here. So it's very simple to do it. Actually, I'm not trying to make this harder than it is. So then you're going to just use the opposite arm. This one. This is the painful arm. I'm going to just lift it up overhead. That's all I got to do. And that holds the shoulder blade in place. And it really, if you have an impingement problem, this is really making it worse. So, if this really hurts when you're doing it, that's another possibility that you have an impingement.
This is called the Neer test, Neer. If you don't have a chair, you don't want to do it that way.
If you just want to go this way, you can. It works a little bit better that way with the stabilization.
And I always remember this because near to the ear.
Yep.
When I was in school, that was my little rhyme that allowed me to remember that amongst 14,000 other tests for the body.
Yeah, no kidding. It's taxing the brain, that's for sure. Okay, next one. This one is not as common. I just saw it. To be honest with myself, I have not used this one, Brad. I'm going to be honest with people.
Yeah.
But I liked it because you can do it yourself.
Right.
So you put your hand out and you're going to turn your palm away from you. So the thumb goes down, you turn the palm away.
Yep.
That's putting the shoulder in internal rotation. So that makes sense to me why this works.
Right, because I guess that tubercle
Yeah.
in the impingement range.
So I'm going to grab the wrist. I'm just going to pull it down to my opposite hip.
Okay.
That's all you got to do. And again, this could also possibly cause some ACL problems.
Yeah.
But it definitely also, if you have some impingement.
Sure. I'm surprised you didn't want to do the Hawkins-Kennedy by yourself like this, but that's okay.
Yeah, well, sure. That's a little bonus.
A little bonus. It's an easy, quick one. The Hawkins-Kennedy. When I'm here, I'll show you. I have one hand here, and I have one hand here, and I rotate. To do it by yourself, you could put one hand here and support, and then let that go down, and then test one side to the other.
Yeah, I always thought there was a little bit of adduction too.
Yeah. There was. I've looked that up.
I've seen it. People do
different
it
ways.
Yeah.
Straight in front of you or out at
they
steps.
go across.
One way or another, be consistent on both sides. And if you do all four of these tests, and like 3 of them are very positive, that's a pretty strong indication.
Yeah, and the thing is, when we show how to treat impingement, there's nothing that's dangerous about it. It's good for every shoulder.
Sure.
You know what I mean? It's not like it's going to be bad for your shoulder.
Right.
You're going to be pretty safe if you treat your shoulder as an impingement.
Right.
So
I agree, Bob.
Thanks for watching.